Hello, everyone. Today I'm going to talk about Clostridium botulinum and a case of foodborne botulism. So, botulism is rare and it can be extremely serious because the toxin affects the nervous system and can eventually cause full paralysis. In this presentation, I'm going to go through the patient's case first and then talk about how botulism is diagnosed as well as treated. And then I'll explain the microbiome, pathogenesis, epidemiology, and prevention. So, starting with the case, we have a 21-year-old healthy male who comes into the emergency room with blurred vision, dry mouth, difficulty swallowing, and overall weakness. What stands out about this is that his symptoms started about 2 days after he ate home canned corn with a friend, and this friend was also having similar symptoms. So, the shared food exposure combined with the bulging can raised concerns. The patient was awake, alert, and did not have a fever, but the combination of the vision problems, difficulty swallowing, dry mouth, and weakness raised cause for concern with botulism. So, one of the biggest clues with botulism is a pattern of weakness. Botulism causes what's called descending flaccid paralysis. Basically, the weakness tends to start around the heart and cranial nerves and then move downward through the body. This matches the patient pretty well because his symptoms involved his vision and swallowing. As botulism got worse, the weakness can move into the neck, torso, and eventually muscles used for breathing, the respiratory system. So the doctors were watching his breathing so closely. If someone looks stable at first, botulism can become life-threatening if the respiratory muscles become paralyzed, as we mentioned. So the symptoms plus foodborne the food history made foodborne botulism a main concern. So the patient's history also helped rule out some of the other types of botulism. First off, he didn't have a history of injection drug use, wounds, or recent surgery, so this made wound botulism much less likely. He was also 21 years old, so infant botulism was also obviously not a possibility. It usually happens in babies who get spores in the intestine where they germinate and produce toxin there. He also didn't have any recent cosmetic or medical botulism toxin injections, so this cosmetic botulism used for Botox and perfecting the skin was not the one he was infected with. So, wrapping all of this up, the strongest clue we have was in the home canned corn, and this is especially because his friend also got sick as well. For the diagnosis, doctors are going to look at both the symptoms and lab testing. First off, they would do a neuro exam to look at cranial nerve function and to see whether the weakness follows the typical descending pattern. They also have to keep checking respiratory function because breathing can get worse as the paralysis spreads. For laboratory testing, these samples can include serums, stool, digestive contents, or even the food. One goal to detect botulism neurotoxin and another to isolate a toxin-producing Clostridium botulism organism. PCR can also be used to look for genes associated with botulism neurotoxin production as well. Another important part is the timing. Samples should be collected before the antitoxin is given because the antitoxin can interfere with some of the toxin activity tests. Historically, the mouse bioassay has been considered the gold standard for detecting the active botulinum neurotoxin. The important thing to remember about this is that it detects the active toxin, not the spores. The only thing about this test is that it can take several days, and with botulism, you don't have time like that. It can progress rapidly. So the symptoms in history suggest botulism. So this treatment will start before the lab results can come back. Okay, let's get into the microbiology. Clostridium botulinum is a gram-positive anaerobic spore-forming bacterium. Anaerobic just means it can grow without oxygen, which is really important when we're talking about sealed canned foods. It can also form endospores. These spores are basically a survival form that allows the organism to survive harsh conditions. When conditions become favorable again, especially in a low oxygen environment with enough nutrients, the spores can germinate into vegetative cells, and those cells can produce botulism neurotoxin. Botulinum is divided into different groups, but groups 1 and 2 are the ones most commonly associated with human botulism. Group 1 tends to grow better at warmer temperatures, while group 2 can grow at lower temperatures. The botulism toxins are traditionally divided into serotypes A through G, and the ones most commonly associated with human disease are A, B, E, and F. Okay, this is probably the most important part of understanding how this disease actually works. So the main virulence factor is actually the botulinum neurotoxin, which we refer to as BONT. In foodborne botulism, the toxin is already present in the food before the person eats it. So the person is actually ingesting preformed toxin. After this toxin is absorbed, it travels through the bloodstream and eventually reaches peripheral nerve endings. Once it gets to the nerve, it binds to receptors on the presynaptic membrane and gets taken into the cell. Inside the neuron, part of the toxin acts as a zinc-dependent metalloprotease. This job is to cut proteins that are part of the SNARE complex. Major targets are SNAP25, VAMP, and syntaxin. But these proteins normally help synaptic vesicles fuse with the membrane so they could release acetylcholine. And without this acetylcholine, the nerve can't tell the muscle to contract, which hence causes the flaccid paralysis characteristic that is very common with botulism. So this mechanism explains why patients start developing these blurred vision, difficulty speaking, difficulty swallowing, and then weakness that progresses to move downward. Okay, epidemiology. Botulism is rare, but it does occur around the world. One study looked at recorded outbreaks between 2017 and 2024 and found 296 outbreaks worldwide. Out of those, 259 were human outbreaks, 1,097 human cases, and 47 deaths. Foodborne botulism was the most common type, making up about 79.5% of human outbreaks. The most common individual food source was dried fish, swallowed by canned fish and canned meat. When the vegetables were grouped into categories, or when the food were grouped into categories, fish products made up the largest percentage, followed by meat and veggies. And another important point is that these homemade foods were involved in almost half of the human outbreaks. That connects directly back to this case because the patient ate home canned corn. This corn is a low acid food, and when sealed in a container, you get that low oxygen environment that Clostridium botulinum likes. If the food isn't processed correctly, these spores can survive, germinate, and lead to toxin production. Okay, let's get to treatment. Treatment for botulism has to happen quickly. The main treatment for adult foodborne botulism is heptavalent botulism antitoxin, which I like to refer to as BAT, B-A-T. The antitoxin works against the traditional toxin serotypes A through G. What it does is neutralize toxin that is circulating in the bloodstream. But the big limitation is that it can't reverse toxin that has already entered and attached to nerve endings. That's why early treatment matters so much. Okay, to wrap everything up, prevention is really important because foodborne botulism is largely connected to food processing and storage. Low-acid canned foods need to be processed correctly because botulinum spores are very heat-resistant. That's why proper pressure canning and thermal processing are so important for foods like vegetables. Storage temperature also matters, because some strains can grow at low temperatures. And one of the simplest things is to remember is that you should never eat from a food can that's bulging, leaking, or damaged. Thank you guys for your time, and I hope you enjoyed.